I'm Wichita Mayor Brandon Whipple.
I'm Teresa Lovelady, President and CEO of HealthCore Clinic.
I'm Wichita Vice Mayor and Councilmember Brandon Johnson.
I'm Sarah Lopez, Sedgwick County Commissioner for District 2, and I'm here to talk about the COVID-19 vaccine.
The COVID-19 pandemic has affected all of us, and especially our communities of color. Minority populations are at higher risk of exposure to the coronavirus due to social determinants of health and longstanding inequalities in terms of housing, transportation, occupation, and access to health care.
HealthCore Clinic offers an integrated approach to care through affordable access to medical, dental, behavioral health, and pharmacy services, all under one roof.
HealthCore Clinic has been serving the community for decades before the pandemic.
They have served the community during the pandemic,
and we will continue to serve long after.
During the pandemic, HealthCore Clinic has offered free COVID-19 testing, hosted pop-up services in communities heavily affected by the pandemic, launched a respiratory clinic to serve the community's most vulnerable in a safe environment, provided ongoing medical, dental, and behavioral health services, and actively worked with the state of Kansas to vaccinate Wichita according to the 5-phase plan.
Now that the vaccine process is underway, we know there are many questions, like, when will it be my turn?
Where do I get the vaccine?
How much will it cost?
Which vaccine should I get?
Is the vaccine safe?
These are all great questions, and we are going to help answer them today.
When will it be my turn? There are limited doses of COVID-19 vaccine available to start, and this is because the vaccine is being manufactured and administered as we speak. The Kansas Department of Health and Environment has put together a rollout plan based on 5 phases.
Phase 1, the initial phase. Healthcare workers, long-term care facility residents and patients, and workers critical to the pandemic response were administered the COVID-19 vaccine.
Phase 2. In January, Phase 2 began, which vaccinated residents above the age of 65, as well as high-contact critical workers such as police officers, firefighters, food service workers, K-12 teachers, and anyone living in a licensed congregate setting.
Phase 3. The third phase of Kansas vaccine rollout is for people aged 16 to 64 with severe medical risk and workers in critical infrastructure, such as agricultural workers, shelter and housing workers, and those who work in social service and government.
Phase 4. The fourth phase of the Kansas vaccine rollout is for people aged 16 to 64 with other medical risks such as asthma, cystic fibrosis, dementia, and also type 1 diabetes.
Phase 5, the fifth and final phase of the Kansas vaccine rollout, is for anyone aged 16 or older. It is possible we may have the vaccine for small children by this time.
To see more details on the 5 phases and determine which phase you or a loved one are in, visit our COVID-19 vaccine resource page at healthcoreclinic.org/got-the-shot.
Where do I get the vaccine? There are vaccine sites conveniently located across Sedgwick County. As more vaccines become available, there will be even more sites.
The Kansas Department of Health and Environment has created a tool called Find My Vaccine. It is an interactive map to show where you can get your vaccine in any of the 105 counties across Kansas. You can find the link to this tool at healthcoreclinic.org/got-the-shot.
How much will it cost? The COVID-19 vaccine is 100% free and no insurance is required. Vaccine providers are permitted to charge an administration fee, but cannot deny a vaccine based on inability to pay. What this means is everyone who wants the vaccine will get the vaccine. When you schedule your vaccine, ask your vaccine provider if they charge an administration fee. If you are unable to pay the fee, please inform your provider in advance. You will not be denied a vaccine.
Which vaccine should I get? There are different vaccines available from different companies. Which vaccine you get is entirely dependent on what vaccine is available when it's your turn and which vaccine your provider has.
Both Pfizer and Moderna vaccines have an efficacy of roughly 95% and require 2 shots administered 3 to 4 weeks apart. They are both mRNA-based vaccines which trigger an immune response that produces antibodies to protect us from getting infected if the real virus enters our body.
The Johnson & Johnson vaccine is 66% effective at preventing COVID-19 overall, meaning it is less effective than the Moderna and Pfizer vaccines. However, only a single dose is required, and it will likely be widely available due to how easy it is to store without refrigeration for long periods of time.
The Johnson & Johnson vaccine is based on the COVID-19 virus's genetic instructions for building what's called a spike protein. But unlike the Pfizer and Moderna vaccines, which store the instructions in a single-stranded RNA, the Johnson & Johnson vaccine uses double-stranded DNA.
To put things in perspective, the flu vaccine has an efficacy of roughly 44%, meaning all of the COVID-19 vaccines are considered highly effective.
Is the vaccine safe? Yes, the COVID-19 vaccines are safe and effective. Thousands of Kansans and millions of Americans have already received the COVID-19 vaccine. The vaccines will undergo the most intensive safety monitoring in U.S. history.
While many people experience little to no side effects after getting the COVID-19 vaccine, most people will experience mild side effects such as soreness at the injection site, a headache, chills, and/or a fever. Most people report these mild side effects lasting for 24 to 48 hours. And these reactions are normal. They show that the vaccine is working and are a sign that your body is developing antibodies. A very small number of people have had an allergic reaction after the vaccine. This is extremely rare. And when it happens, vaccine providers have medicines available to effectively and immediately treat the reaction.
Finally, once you are vaccinated, please continue to follow social distancing measures such as wearing a mask, remaining 6 feet apart, and washing your hands frequently. While you may have developed antibodies from COVID-19, you can still spread it to someone who has not yet been vaccinated. HealthCore Clinic and other state agencies will continue to provide updates and recommendations.
To beat this thing, it will take all of us chipping in and doing our part.
It's our civic duty.
It's our responsibility.
It is our moment. And together,
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 we can achieve immunity in our community.